Director of Long-Term Care Community Coalition. I thank you all for joining us today. I'm really excited for today's program myself. It's going to unravel or unfold as a very interesting afternoon, I think. I'm also, and most importantly, really proud to host the two programs, the Hudson Valley program and the Tri-County program of the regional offices of the New York State Long-Term Care Ombudsman Program. We at LTCCC have worked closely with Ombudsman programs across New York and across the country for many, many years now throughout our lifetime. You guys are, to me, one close to my heart and always provide such important services to residents and to their families. So I thank all ombudsmen. Thank you all for joining us. And without further ado, I'm going to pass it over to Judy Farrell.
Thank you, Richard, and thank you to LTCCC for sponsoring today's town hall. I'm the program director, as Richard mentioned, of the Tri-County Long-Term Care Ombudsman Program, which is Region 4, and which covers the counties of Westchester, Putnam, and Rockland. I come from a background of 25 years of being an advocate for healthcare and long-term care, having worked for a not-for-profit large home care agency, as well as a not-for-profit managed long-term care plan serving people with disabilities. And I'm delighted now to have been working over a year as the Ombudsman for Region 4 and part of the Long-Term Care Community Coalition, as well as the State Long-Term Care Ombudsman Program. I also have some personal experience with nursing homes and long-term care facilities, as both of my parents were in and out of facilities throughout the later years of their lives. There were some challenges, and I know that many people experience challenges when their parents or their loved ones are in long-term care facilities. There were some joyous moments, and in particular, I remember one moment when my dad, towards the end of his life, was visited by his nephews from Ireland. And unbeknownst to us, they took him out of the facility for a day, a whirlwind day of touring, and took him out for a meal. And our family was surprised to get a call from the nursing home, "Where's John?" But he actually recalled that as one of the happiest moments of his life. So it's important to capture the joyous moments that you have with your loved ones in these facilities as well. But we are here to help you with the moments that might not be so joyous when they have challenges or problems. The Ombudsman Program's mission is to serve as an advocate. I'm just going to share my screen here so you can see some of my slides. We are advocates and resources for older adults and people with disabilities who live in long-term care facilities. As advocates, we are resident focused. One of the focuses of our program is to always be available to the resident and maintain a resident focus. The Long-Term Care Ombudsman Program also stresses confidentiality. It's really important for us to build trust with the residents in long-term care facilities. We need their trust to help solve their problems. So maintaining confidentiality is key, and that's what we do. We're also accessible. Accessibility is an important value. We are there for the residents. We want to be accessible to them. It was challenging during the pandemic because we were only available over the phone, but now that we're going back into facilities, we hope to see as many residents as possible, and we also hope that they will continue to call us as they have been doing. Prevention is also another value. We want to prevent a problem from escalating. So the sooner someone reaches out to us and tells us they're having a problem or a challenge or a complaint within a facility, we want to immediately try to address that before it escalates into a bigger problem. And one of the key values of the Ombudsman Program is resident empowerment and autonomy. Very often a resident complaint might be able to be addressed by a conversation between the resident and a staff member. I know myself, I've walked some residents through how to speak to staff members who might be handling something that is presenting a challenge for them. So resident empowerment is also a key value. Complaint resolution is the goal of our role as ombudsman. Resolving the complaint that is brought to us by the resident or their loved one is really a key value. It's something we strive to achieve. We are not always successful, but we do the best to our ability to resolve that complaint to the satisfaction of the resident. And it's the resident's complaint that we are focused on resolving to their satisfaction and what's in their interest. The complaint and the problem that they brought to us is our focus. Objectivity is another important value. We must not bring our own bias or baggage or any preconceived notions with us when we're addressing a specific complaint from a resident. We have to have objectivity. We have to look at it, try to look at it from the resident perspective, remaining resident focused.
Thanks, Judy. For your PowerPoint, if you could click from current slide, the audience will get a better view.
Okay.
And also just
Is that better? Is that better?
Yeah, it's better now. And also, I just want to remind everybody we're doing a Q&A at the end. So if you have questions for the ombudsman, use the Q&A feature, and we'll try to get to some of them. Judy, if you have any other notes on that, and I'll relay this back to you.
Sure. Thank you, Eric. It's important. We are in Region 4, my program, and Kathy Scanlon, my colleague who's here, we are the staff in Region 4, but we are part of a larger program that's statewide. There are 15 regions. So I just wanted to walk you through the administration of the long-term care ombudsman program in New York State. The Older Americans Act, administered by the Administration on Community Living, requires each state to establish an office of the state long-term care ombudsman. And in New York, the program is administratively housed with the State Office for the Aging and provides advocacy services through a network of 15 regional programs. There are 3 assistant state ombudsmen who supervise all of the regional programs, and they are overseen by a senior assistant state ombudsman and the New York State Ombudsman, Claudette Royale. To manage the 15 regional long-term care ombudsman programs from the state long-term care ombudsman office, each ASO in the state office is individually assigned to 5 separate regional long-term care ombudsman programs. Each regional ombudsman has a designated ombudsman coordinator who recruits, trains, and supervises a core of volunteers that provide a regular program, and they visit with their presence in nursing homes and adult care facilities on a weekly basis. Okay, waiting for the slide to advance. Eric, okay, it should advance.
Yeah,
Oh, I see.
You're
Okay,
good.
there it is.
Yep.
It is really important for us to inform residents and their loved ones of their rights. One of the first things that we do when someone calls us in the office or if we visit a facility is to inform them of their rights. Residents in long-term care facilities have the right to dignity. They have the right to be treated with humanity, kindness, and as individuals. They have the right to privacy. Residents have the right to privacy in their treatment, in their care, in their private relations and communications with individuals in and out of the facility. Residents have rights as far as their care is concerned, and they have the right to equal care, to equal treatment and services, irrespective of their source of payment. Residents also have the right to personal property, to possess and use their personal property, to ensure that it is protected from theft, and to manage their financial affairs. Information is a right that the residents have, and they have the right to participate in decisions about any treatment, including the right to refuse treatment. Residents have the right to freedom. They have the right to make choices about their schedules and activities and to be free from chemical and physical restraints. I just want to share with you a poster that we put up in every facility in New York State. The Ombudsman program provides all facilities with this poster to be visibly accessible to all residents, employees, or other persons, to make them aware that they may file complaints or provide information to a long-term care ombudsman, and call locally where that you see that space. My number, our number here in the Tri-County Long-Term Care Program will be on this poster in facilities in Westchester, Putnam, and Rockland counties.
Judy, can
Yes.
Can you go back to the slide before resident rights where it had the numbers of
Yes.
that one?
Thank you, Gloria. That's a very good point. I don't want to gloss over this. It's really important to share with you the numbers in New York State because they're pretty impressive. We have 1,500 long-term care facilities in our state, over 160,000 beds. We have skilled nursing facilities, adult care facilities, and family-type homes. We have 35 full-time staff and 15 part-time staff statewide. That's for the whole program for these 1,500 facilities. And we have 250 certified volunteer ombudsmen. In my region, Region 4, which is a tri-county program, we have 130 facilities, 2 full-time staff, and 19 volunteers. I think we are done with the slideshow, but I just want to introduce you to my colleague, Kathy Scanlon, who is here with us today. Just so you will probably speak to her if you call in, or you may see her in a facility visiting. So Kathy, I just wanted to introduce you. You can say hello.
Hi, everyone. Thanks for being here today.
And without further ado, I'd like to introduce Gloria Murray, who's in Region 5.
Thanks, Judy. Hello, everyone. Thanks for being here today and learning about the Ombudsman program that is such a well-kept secret to everyone until, so here we are today. Thank you to LTCC, Richard, Haley, Casey, everyone, Eric, who put this all together for us, and we're excited to be here. I'm going to talk to you a little bit today about the responsibilities of a long-term care ombudsman and why we use volunteers and how it all works. So you all know how to reach us. And then at the end, I'm going to introduce my staff, which I'm excited to present to you, and also a volunteer that's been with us for a very long time. So as a long-term care ombudsman, volunteer or staff person, we are responsible for investigating and resolving complaints. We are responsible to educate consumers, provide residents about their rights, advocate for quality care in long-term care facilities, and we want to promote development of resident and family councils. The one thing we do not want to do, we do not want to take the residents' voice away from them. We want to empower them to speak up and feel comfortable speaking up, and if they need our assistance, we are there. Our ombudsman authority under the Federal Older Americans Act is to access all long-term care facilities without interference. No one can stop us from interfering. And the resident has the right to see us. They have the right to see whoever they want. I'm sorry. We also have access to residents and medical records with consent from the resident, and our program is HIPAA exempt, but we do need a resident to give us authorization, or if the resident cannot, then the family member can. Okay. So our role, we're a listener investigator, which means we gather information and we evaluate the facts. We want to listen to the resident. We want to give them our ears. We want to make sure we hear what they're saying and we understand how they feel. We want to educate on resident rights with the responsibilities and the regulations on how to choose a nursing home, on a staffing, on a resource in the community. We're there for them. negotiate, mediate, collaborate. We want to help to improve communication and find acceptable solutions, act as a third-party facilitator between roommates, other residents, staff, administration. We are there wholeheartedly for the residents, and remember, residents, all residents. So if roommates are not getting together, we need to understand both sides of it. We're policy analysts. We take a look at the broader policies that impact resident life. And right now, today, there's going to be a few of those coming out in the near future. Next. We are a consultant. We provide information. We might just help families navigate through the whole nursing home, long-term care experience, if that's what you want to call it, because they don't know. And residents do not know that either. So we want to make sure that we can help them navigate through that. We want to advocate on behalf of residents as individuals and as groups. So not only do we listen to the residents' complaints, but also if we hear a lot of residents talking about and complaining to us about a lot of things, meals, food, whatever, no lack of call bell, response, there are things that we can investigate without ever identifying a resident. We want to be a problem solver. We don't want to be a Band-Aid fixer. We want to be a problem solver. We want to make sure that it's thoughtful and it assists in resolving resident problems. We don't want to just put a Band-Aid on a situation. We want to truly understand what the root cause is of that problem. We want to do system change. We are a system change agent, meaning we're advocating for concerns of residents and the need for change on systems level. We work on broader underlying problems for residents in long-term care. That's where we say it's our complaint and we take it on and see what's going on in the facilities. So similar but different. We have some similarities here. Both the Department of Health and the LTCOP are oversight entities for long-term care facilities. We both have the ability to investigate complaints on behalf of the complainants. Our differences, however, the LTCOP investigates in a much different way than the Department of Health to identify the root cause of problems, to assist in mediation with facility staff, to resolve resident complaints before regulatory action becomes necessary. With the LTCOP facilities, have an opportunity for significant improvement before receiving a formal citation for a given problem. So what that means is we really want to work together. We as ombudsmen, volunteers or staff, we walk two very fine lines. We walk a very fine line with the resident to make sure that they gain our confidence, that they trust us, that they know we're there for them and we're not going to compromise them. We're not going to identify them. But we also need to walk the fine line with the staff because we need to develop a working relationship in order to make sure that we can come to a resolution and hopefully make some system changes or even just make changes for that resident who's having a challenge right now. So we have two very fine lines that we walk as ombudsmen, and we do a good job most of the time. So the LTCOP's primary focus is to be resident-centered at all times. The resident is always the first person with whom an ombudsman must discuss any complaints or concerns. No matter who calls our office, family, friends, cousins, state legislators, anyone, we have to talk to the resident first. We want to see we want to see the resident and understand what's going on. A resident's wishes always remain the focus and priority of any action taken by an ombudsman. That is why we are resident-centered. And I want to say our accessibility is our volunteers need to be in, and they sign up for this, in those facilities on a weekly basis, gaining that trust, gaining that confidence, showing those residents that we're there every week to see how they're doing. We don't go the same time every week. We try to, and we encourage volunteers to mix it up, go at different times, different days. So this way, no one ever knows when you're coming. You always want to see how things are going for the residents. We as staff, if we don't have volunteers, we need to be there quarterly. We need to make visits quarterly, or we have to be responsive to complaints when they come into our office. So we have a big job, and you saw the numbers that are out there. So we encourage families and residents to call us all the time. We do need permission to act before beginning any investigative work on behalf of a resident. An ombudsman must receive verbal permission to do so from the resident or their representative. A resident or their representative is always first fully informed about how the ombudsman program can help them. And the resident or their representative then needs to give the ombudsman verbal permission to work on their behalf to resolve their complaints, to review their records if needed, and to reveal their identity and or information in order to help resolve their complaint. The ombudsman must then document the verbal permission was granted in their own documentation. Yes, we do have documentation responsibilities. So to become an ombudsman, a certified ombudsman, staff and volunteers, doesn't matter, we must complete a 36-hour certification training. Volunteers also participate in 6 additional in-services each year, and they are all related to long-term care issues. And our volunteers commit to 2 to 4 hours weekly in a facility. We use volunteers. It's an added level of authenticity to the program. It represents the community and assists in protecting vulnerable older adults. It represents the grassroots advocacy approach that aligns with the mission of the Ombudsman program. It provides more eyes and ears in the facility and assists with facility coverage as far as being in there and seeing what's going on from the Ombudsman point of view. So we have some volunteer challenges. We have challenges finding volunteers, keeping volunteers, commitment to meeting established program expectations, the skill set and temperament, and the consistency. So what I mean by the challenges too is that when I said documentation, there is documentation for us to do when we investigate complaints, because we need to make sure we are doing what we should be doing for the residents. So let me, I skipped this in the beginning, but I'm very sorry. So let me just tell you a little bit about myself. I have been with the Ombudsman program and LTCCC here in Region 5, which is Columbia, Dutchess, Ulster, Orange, Sullivan, and Greene counties. And I've been here since 2015. And every day has been a different one, but I'm very excited to be here, and it's been an amazing experience for me. I have been in healthcare my entire work career, from nursing, and I was in a nursing home when I first started out. And I've been through every form of healthcare right now, every part of it, from home medical equipment to you name it, I've done it. Doctor's offices. This has been the best by far for me, and I find it very rewarding as much as it's challenging. So at this time, I do want to introduce my staff, and I'm very excited to have them on board with me. I want to introduce first May Rossi. May is just starting with the program. She's going to be trained in the next 2 weeks, and she will be covering Columbia and Greene counties, and will be visiting residents more routinely. And I'm very excited for that. May?
Thanks, Gloria. I'm happy to be part of the team. I'm looking forward to the training next week and 2 days the following week, and then to get to work.
Thank you, May. And next, I would like to introduce Teresa Norbaum. Teresa is returning to the program, and I'm very excited. She was with me for a couple of years and left for a little while. Teresa now returns, and she's covering Ulster and Sullivan counties.
Hi, I'm Teresa. As Gloria said, I've been in and out of the volunteer program. I just came back. I'm very excited to cover Ulster and Sullivan counties. All of the facilities in those areas I do know, and I'm excited to get back in and see what's going on, especially after COVID, since I wasn't a volunteer or a staff member during that time. So I'm looking forward to it, and I'm going to retake the training class again next week and be out there the beginning of July in those 2 counties. Thank you.
Thank you. Thanks, Teresa. And I also have Jackie Benessi, who unfortunately is not with us today, but she covers Orange and Dutchess counties. So we are well covered, and we have 11 amazing volunteers that have stuck with me through and stuck with the program through the COVID, which was very challenging, but they have been there with me since last March when we closed our doors and went remote, and they have stuck with us, and now they're heading back in and getting ready to visit the facilities. So at this time, I do want to introduce one of my longest ombudsman, who has been with, she has been with all of my changes, and for the last 6.5 years, she has taken on every challenge that has been out there, because she's been with the program for I think 17 years almost. And she's sort of my go-to when I have questions and need some realigning. So Barbara Stuck, I'd like to welcome you to the panel, and if you would like to just give a little bit and your presentation on how it is to be a volunteer.
Sure. First of all, I want to thank everyone for having me here. As Gloria said, I've been an ombudsman, I think it's almost 20 years now, and I'm a retired kindergarten, first grade teacher, so I have experience as an educator and also experience resolving disputes. And resolving disputes between 5-year-olds can sometimes be similar to resolving disputes between 95-year-olds. So that experience does come in handy sometimes. I have been with the program a long time. The program has gone through many changes, and I have evolved as a person through these changes. So it's been a growth experience for me also. I think many people become ombudsmen either because they've been a caregiver or they've had a loved one in a facility and they've run into circumstances that they were not happy with. And so it gives them a motivation to try to change the circumstances. One good thing I think that the pandemic has brought about is it's brought awareness to our program, and also to the problems that we've been advocating for many years, such as poor staffing or poor infection control. Now those things are more out in the open, and hopefully more people will get on the bandwagon and help us resolve them. As has been said, our program is resident-centered, and we advocate for residents. We educate them on their rights. We help them learn how to advocate for themselves, and that gives them a feeling of empowerment. I enjoy the residents very much. I actually love the residents. I love talking with them. It's kind of like living history, because they have fascinating backgrounds. And I think most residents just want recognition as a person, instead of just a job that someone has to complete and move on to the next one. They appreciate someone listening to them and genuinely caring about them. And I think if you put yourself in their shoes, you could definitely understand how they feel, or think, well, this could be my mother, or this could be my grandmother. Would I want this happening to have to them, or or are they getting the services that that they deserve? I find it very rewarding, as Gloria said. I think I get as much from the residents as they hopefully get from me. I was very anxious about going back to the facility after COVID, but I had one resident I just had to see, and once I got back, it was a good feeling. And it was also a good feeling to see that most residents remembered who I was, even with a mask. They knew who I was, and they were glad to see me. And I think it's important to develop a feeling of trust. They know they can trust me. They know I'm not going to share anything with anyone unless they give me permission. I think one of the things, I also think as an ombudsman, when I first started out, I thought, well, even if I can't make any great big changes, at least I can brighten someone's day. Little by little, I'm getting a little more hopeful, because little changes are coming a little at a time. And I think that's a step in the right direction. I think one of the things that's a little bit difficult is you can't help but get attached, at least I can't, to residents, and then they pass away. The first time that happens, it's kind of a jolt to your psyche, and then you just have to reflect at the good things you help them with. But that's something that you have to adjust to, I think, as a volunteer. Also, there used to be much more paperwork than there is now, and that used to be kind of a drawback. But I also learned to grow and understand that without the paperwork, we wouldn't have the funding for the program, and the funding is essential for us to continue. So just getting back, I noticed a change in the facilities because residents are still not out and about as much as they were before. If you can imagine being in your room for such an extended period of time, I can't imagine how they survived, but many of them, most of them in my facility did. So our job is to listen to residents, even if a family member wants something different than the resident wants. It's what the resident wants that's important. We definitely inform them of their rights. We teach them how to advocate for themselves. I remember one incident, this was way back when I first started. There was a small group of ladies that I got to know, and they were upset about the diapers. The diapers were not the right size, and the facility wasn't doing anything about it. And when the state came in and did a survey, one of the ladies spoke with the surveyors and conveyed their concerns, and then they got the right diaper size. So residents can do a good job of advocating for themselves, and I think it's really important to listen to them because they're walking the walk. They're living the life, and what they say is most of the time true. And so I think being an ombudsman is a wonderful experience. It's a way to give back to the community. It's a way to grow as a person. We're all getting older, and it also helps you learn about the system and how it works. Gloria does call me. Gloria is good. She's there whenever we have a problem. We can always call her, and she helps us also. So I'm just very happy that I'm still able to do this. And I thank you again for having me as part of this program.
Thank you, Barbara. And thank you for being part of the program.
That was wonderful. Thank you, Barbara.
Yes. Judy, I'm going
And
to
I would just like, oh, thanks so much, Gloria. It's just wonderful to have such dedicated volunteers like Barbara. And we're fortunate in Region 4. I'd like to thank all of our volunteers. We have 19, and it's amazing their commitment to the facilities they serve. It is rewarding and you can make a difference. So we do need more volunteers. And there is a link in the chat if you would like to volunteer for either of our regions. So please click on that link. And now I would like to introduce a family member of a resident, Janine Ferrari. She has been a leader in Region 4 in organizing a family council and in just advocating on behalf of the residents. And she has some experience with the Ombudsman program. So without further ado, Janine, please.
Hello. I just want to talk to you about Judy Farrell and what she means to us in our family group. Our family group is about 97 members, large, which is pretty significant to us. Judy Farrell came into our lives last spring. We were at our wits' end, not knowing what was happening inside the New York State Veterans Home at Montrose. The nursing home had abruptly shuttered, and for 2 months, we didn't know what was going on with our loved ones. They hadn't contacted family members immediately, and when we called, the phones just rang and rang. We weren't aware of the residents' rights and our rights, and we didn't know where to go to for the answers. Fortunately, our co-founder, Michelle DeRota Taylor, came across an LTCC webinar with Richard Mallow, and shortly afterwards, we inquired about meeting virtually as a family council using their Zoom room. Judy has acted as our advocate and sounding board. She and Richard they've guided us. They've encouraged us to contact our legislators, reminding us that our voices count, especially now because we're constituents. Our family group is 97 members strong, and thanks to Judy, we've become more assertive and savvy about residents' rights and federal and state guidance. We've written grievances, written emails, and made phone calls. We've been empowered to push back on our nursing homes' erroneous and rigid regulations. Judy follows up and corresponds on our behalf with the administrator and staff. And because of Judy, they have had to pay attention to the families and recognize that many of us are the decision makers for our loved ones. Prior to the pandemic, the Montrose Veterans Home used to host the family council meetings at the nursing home with a presentation and a guest speaker, a lunch offering, and 10 minutes of Q&A at the end of each program. Some local family members would attend, and though attendance was always low, more importantly, none of us knew that it was wrong for the nursing home to drive their agenda using this format and platform. Now we're able to meet more frequently, and we spend up to an hour discussing what the residents are telling their family members and experiencing over the past 15 months since March of 2020. Our family group serves to advocate for our loved ones and to support each other. We know that we are one of many family groups across the state and across the country who are experiencing the same issues. And we recognize how fortunate we are to have received an education on residents' rights throughout this pandemic. Our family council knows nothing will ever be the same once nursing homes open again. This will be in large part thanks to people like Judy Farrell who lead by example and apply themselves by filling a critical need during this devastating time in history when we have lost so many of our seniors in nursing homes, both to an insidious virus and to the failure to thrive in isolation. If one good thing came out of this pandemic, it is that residents and family members have found their voices. By meeting virtually in the LTCCC's Zoom room and by taking advantage of the technology available to us today, be it emails, podcasts, and webinars, and able to invite anyone we want to our family council meetings, we have been able to include family members who live remotely, some as far away as Israel. And the support, especially with an ombudsman in the Zoom room, is palpable. These remote family members are as close as being in the same room together. We love seeing Judy Farrell in person when she's able to attend our Zoom meetings. She is the picture of composure, the voice of reason. She offers comfort and sage advice, and she talks us down from the ledge. We love her awesome colleagues and her interns who sometimes sit in when Judy is not available. Kathy Scanlon comes to mind immediately. She was filling in for a few days while Judy was away in April. This happened just after the New York State Department of Health had delivered the much anticipated updated visitation guidance for nursing homes on March 25th. The administrator for our nursing home had taken that week off and had told everyone who could listen that she would be back in a week and she'd look at the guidance then. Kathy Scanlon reminded us and rallied us when she said the guidance is dated March 25th and is in effect now. It should not wait until the nursing home has time to read it through and apply it. We needed, as family members, we needed to hear this. We recognize that ombudsmen are empowered in a positive way and that by design, they empower family members when we are equipped with knowledge and the strength it takes to speak up for our loved ones. And more than that, our loved ones are also finding their voices. They are clamoring to be included in the Residents' Council because they recognize that their own voices are as strong as the voices of the family members who love them. I know that many, many family members in our group will forever be grateful for the Ombudsman program and will always support its volunteer efforts and its ability to make change where it is needed. Right now, our nation is going through the next COVID-related dilemma, and this is how to replenish the volunteer resources in so many organizations, large and small, that were decimated by the pandemic. We know that the Ombudsman program has been working under these same circumstances. We vow to support the efforts, and we are looking into how we can help with this campaign to identify the next generation of ombudsmen for a program that has done so much to protect the rights of our loved ones and made real differences in their lives, especially during the last 15 months. The opportunity to say this to Judy in front of her colleagues today is a great privilege to me. Judy, we respect you and your position. We are grateful for your guidance and for your hard work on our behalf of the New York State Veterans Home at Montrose Family Council. We know that the next volunteer who fills the seat of ombudsman for our skilled nursing facility will walk in your shoes and deliver the same selfless service to humanity as you do. And we thank you.
Janine, thank you so much for your leadership. It's really the Family Council at VA Montrose has made changes, and Janine has played a tremendous role along with the other members, Michelle and the entire council. They really are focused on their loved ones, and I applaud them for their advocacy. And now I think we would like to do some questions and answers. I'm going to hand it over, I believe, to Eric, who is part of the Long-Term Care Community Coalition staff. Thanks, Janine.
Yeah. Hi, thanks. That was really great. Thanks to Janine, thanks to Barbara, Gloria, and Judy. That was really powerful words. And thanks to, we have a fair amount of participants. Thanks for listening, and thanks for submitting all your questions. I'm going to take my video off because this is going to be Gloria and Judy answering the questions. And just as a disclaimer, it's possible that some of these questions might not be able to be answered, but Gloria and Judy will relay what they are able to respond to. So I'm going to start with a question from Jennifer, who asks, what has been your most common complaint from residents now that you're back in the facilities, or maybe have more access to the facilities? If you can answer this however you'd like, Gloria, Judy, you can choose among yourselves how you want to respond.
Sure. I know my top complaint, both before and after reentry to the facilities, has been visitation restrictions. We are still experiencing, although people all over New York State are hearing that everything is opened up, not all of the nursing homes and long-term care facilities are open up to visitors. And it's been a struggle assisting families in scheduling visits. So I think that's a great challenge and complaint that we are currently hearing. Also, staff shortages in the facility are another complaint. When people do go back in to visit, that there seem to be some staff shortages. Gloria, do you have any further comments?
I agree, Judy. It's visitation and it is staff shortages, with not enough staff being there to answer call bells, taking care of them. Yes, we still get the food issues, but those are the two top ones right now, are the staffing and the visitation.
And I will say what I say to families that contact us about that, and residents, contact your elected officials and, write letters, make calls, because you can make a difference and make change, but they need to hear from families if you feel like you cannot visit your loved one.
Okay, thanks for that. And here's a question from Carolyn Rodriguez. Is it legal for nursing homes to refuse a long-term patient because they don't have any long-term beds?
So, is it legal? That's a deep question, but legal has a lot of meaning there. Is it in their practice? So a long-term care bed or a rehab bed, all the beds in the nursing home are beds. Some are covered by Medicare, some are covered by Medicaid. And the facility determines whether it's a rehab bed or whether it's a long-term care bed, according to their census, according to their ability, their capabilities. If there is a challenge right now on long-term care beds, because most facilities do want to admit the short-term rehab patient, but I would say that if you're having a problem with getting your loved one into a facility because of that reason, I would reach out to Judy or myself and we can see how we can help you, but we can't make a facility admit someone. So I don't know if that answers the question, but the question is that there is no real designation to long-term care bed or short-term rehab bed, except for what the facility is putting in their census. And they may not have a long-term care bed in their field, that the beds that they have are full and they want to save it for short-term rehab. So I would look further into that with your ombudsman. Judy, anything more on that?
I agree. And the only reason that they should, if they're not adequately staffed, of course, the state has said they shouldn't admit residents if they don't have enough staff, but they should not turn you away if they have a bed. Okay. And reach out to us, reach out and call us.
Great. So our next question is from Diana Shaver, and it's, who can contact an ombudsman and how do you find out who the ombudsman is? And Gloria and Judy, if you could, you can send me a link or any information, and I'll post that in the chat as you're responding to this question.
Sure, I will send you a link, Eric. You can find all of the long-term care ombudsmen across New York State at www.ltcombudsman.newyork.gov. And that will have for all the 15 regions, the contact information. If you go to the Long-Term Care Community Coalition website, you can find contact information for Gloria and I, and that is nursingHome411.org.
If you just even Google Ombudsman New York State, you're more than likely going to come up with the New York State Ombudsman, the New York State Long-Term Care Ombudsman link, which you can just click on and then find it. But also, again, all of our posters should be up in every facility, every nursing home and every adult care facility. And it should have the local number for them to call. We don't put our names, like Judy's name is not going to be on it, or my name is not going to be on it. The volunteer's name is not going to be on it because, at any point a volunteer can decide not to want to volunteer, and then we don't want her name or his name on the poster. So it's basically just Judy, the poster that Judy showed in the beginning. It's there with the 855 number that can be reached. And if you say I'm from Westchester County, it's going to connect you right to Judy's office, and anyone can call.
Yes.
And our volunteers, the reason that they are in the facilities on a weekly basis is not just, it's more than consistency and establishing trust with residents. It's also to keep handing out our information to the residents. We have cards that we hand out, brochures, resident rights, bookmarks, things with our phone numbers on it. Our brochures tell about the program. So we'll leave it with residents. So maybe when their family comes in, they might see our name, the information, and they'll pick it up and call us if they need us. So we try our hardest to get the information out there. We would like it if all facilities put our ombudsman information in their admission packets. So it's something to work towards. I know some of them do, but it would be great if all of them did it.
And during the pandemic, we, with some grants that the LTCCC helped us get, we were able to send cards to every facility in our regions to give the ombudsman information to residents. So we are constantly out there sharing information, and you should be able to contact the ombudsman in your region.
And I'm sure Judy will agree to this. We will come and speak to any group who needs a speaker.
That's right.
Any event that's going on, anything, fairs, health fairs, anything. We will come out and have a booth and talk about the program and let everyone know that we're out there. That is what our goal is. Our goal is to do outreach and to start recruiting volunteers who want to help residents in these nursing homes and be advocates. So next question, Eric.
Yeah,
Yes.
thank you.
Thank
We'll post some of the slides from this presentation. If you're attending this, you'll receive an automatic email in a couple of days with the link on nursingHome411.org, which will include some of the contact information. And I want to plug this again. If you go to nursingHome411.org/volunteer, again, that's nursingHome411.org/volunteer. You can find a lot of the information that you've heard today. And relatedly, I'm going to combine two questions, two, I think, very important questions. One is from Karen Smalley, who's the Assistant State Ombudsman who oversees Region 5 in the Hudson Valley, and another is from Michelle Dorota. And let me make sure I get the question right. Part A is, can Gloria and Judy talk about the volunteer application and training process? That's from Karen. And the second part of this question is, do candidates interested in the Ombudsman program need to have any special qualifications, and what's the training like? That's from Michelle. I know you went over some of that in the presentation, but I think it's worth going over again.
Sure. So a volunteer, we have our volunteers, and I'm sure Judy will agree, are from every walk of experience in their lives. They're mostly seniors who have retired and who want to give back to the community. So they come in and it is a vetting process. You do have to fill out an application, and it is now very easy for especially Region 4 and Region 5. You can go on LTC's website and click on one of our territories and it'll take you to volunteer and it'll take you to the application process, and you send it in. We will contact you and set up an interview because we do want to interview with you. We want to talk to you about what it is that you have to do, and we want to make sure we lay it out clearly for you so there's no surprises, including the documentation, because I will never lie to anybody. You will have to do documentation. There is paperwork. We then checked references, and we do have to do a first level sex offender check. And we will we will do a pre-classroom shadowing with you and take you to a nursing home or an assisted living adult care facility and have you shadow us and see what it is that we do when we're in those facilities. And we will train you to do the same thing. If at that point you decide that it's not for you, you didn't sit down and take a 36-hour class, which is required, and it is an in-person class. I do have one coming up next week, and then I will do another one in July, and I'm hoping maybe to do another one in September. So we are trying, and we are excited to say that there's going to be some changes to our certification training after October 1st. So we are doing everything we can to rebuild our programs from COVID, but it is, the one thing that you do have to sign is an agreement that you will, do 2 to 4 hours a week, and you will do the documentation and attendance services and all the other stuff. But the other thing too, we want to be very careful is that there's no conflict of interest for you or the facility. And if there's anything that, if you've had a very bad experience with a nursing home, and maybe this isn't right for you, because we don't want anyone to go out there and try to get a nursing home in trouble or to do anything like that. Judy had mentioned objectivity. Objectivity is important. We cannot have judgment. We cannot have judgment about the facility. We cannot have judgment about the resident. Our focus is clearly how to resolve a situation that is sitting in front of us. And our volunteers are totally trained to do that. Objectivity is very important. So again, we do look forward to and do look to grow our volunteer base for sure. Judy, anything you want to add to that?
And Gloria is a great teacher. So the certification is really a great program to really inform you as a volunteer and give you the skills that many people do come to the program, as Gloria said, with skills already, many professionals or people in other walks of life. But you do have to be objective, and you do have to treat each resident as an individual. And it's a great, rewarding experience. I encourage people who really want to make a difference in the long-term care system to really think about volunteering, because you can make a difference even if it's on that individual residence level.
Absolutely. Absolutely.
Okay, and I have a quick follow-up on that. It's Eric speaking. Are there any kind of professional benefits from the experience? How might it relate to someone trying to build a resume or a career?
Well, there's a lot to learn, and I have had volunteers, and Teresa is one of them. I know she's not, plugged in right now as far as on mic, but Teresa came and when she went through training, she did say, and has always said, that she learned a lot and thought about things differently. It was just a very educational session for her. But what we don't want someone to do is, we want people to stay with our program. So although you might want to build your resume, remember most of our volunteers are retired. Although, we want to spread it out and open it up to more people. So no matter what you learn from us, it's going to help you in whatever career you are headed.
Definitely. It is, the experiences you have will definitely enhance your education going forward if you are looking to move into a field that's related to long-term care. But we are looking, as Gloria said, for people who are committed to this program. And hopefully it's a long-term commitment. Objectivity is important so that people don't burn out. Like you don't want to be in a position where you do take on people's problems and take them home with you. It's important to really have balance in all aspects of your life, including in volunteer work or in staff work.
And that's what Judy and I are, that's why we're here as regional directors, because no volunteer or staff person is left to figure things out on their own. We're here to help them. So yes. And I just want to say that there's 15 regions in New York State, and 15 regions are looking for volunteers. So if you know anyone across the state who wants to volunteer, just tell them to go on that long-term care ombudsman website and check out the region where they are and contact that regional director and become an ombudsman.
Yes. And we do have the support of the Office of the State Long-Term Care Ombudsman. So, we reach out to our Assistant State Ombudsman, our ASO, for support when we have a question or a challenge that we feel we need additional support. So it is a program where across the state, we work together to really address the issues that are facing our loved ones in long-term care facilities.
Okay.
And you will be part of that team if you volunteer.
Thanks. And we're got a few minutes left. This one is a kind of complicated question. It's from Janine, who you heard speak earlier. The first part we kind of just already answered, says, how can family members help support our ombudsman? And the second part is, can ombudsman help family members wrest control of resident and family councils from nursing homes?
Judy, do you mind if I'll try to address that.
Yes.
So a resident council is exactly what it is. It's a resident council. And it is a function that the nursing home is responsible to make sure happens for the residents. It is their time to get together and talk about their challenges at the facility. It should be confidential. However, in working with many residents in resident council, and I know our volunteers have done so as well, residents become, they look at the staff, and they do need a staff person in there to take their minutes. And the State Department of Health does look at that on survey. They look at the minutes of the resident council. So it is the responsibility of the nursing home to make sure that resident council happens for those residents. On a survey, the Department of Health will pull a resident council together and talk to them privately. But there is staff involvement on a resident council in the facility. A family council, the facility, it should be separate from the facility. The facility should have no administration, ruling over the family council. You can meet when you want, but they should, and there is a requirement, they should help you grow your resident council. They should put a notice out there for you. They should send, at least once a quarter, they could send a mailing for you. So they do have some responsibility in helping you build a resident council, but they do have a responsibility to the residents for that resident council in the nursing home.
Thanks. And we're at 1:59. So I know a lot of people sent some good questions. Unfortunately, we're not going to be able to get to all of them, but I want to thank you for sending them in. And as we mentioned in while we were promoting the program, people who did submit questions to the forms will be entered in some sort of raffle for a small gift card. So look out for an email for that if you did submit a question through forms. And Gloria and Judy, if you have any final words, we can wrap up the program here.
Sure. Well, thank you, Eric and Haley and Richard and all of our volunteers and Gloria and Kathy. It's great to be able to share this information with you. And we hope that you or someone you know will volunteer. We're here. We need you. We're here to serve you. And please don't hesitate to call if you need us or if your loved one needs us.
And if there's any questions that you didn't get answered, just reach out to Judy or I, and we'll do our best to answer them for you. This is by far one of my most rewarding careers moves that I've ever had. So being an ombudsman is an awesome job, and it is challenging but rewarding. So thank you all for being here. Thanks LTCC for sponsoring us today.
Thank you.